Research articles are an excellent platform to disseminate a novel finding to a general or a focused audience which may be interested in replicating the experiments. So the next topic is how to write a research article. The chairpersons are Dr. Venkatesh Pandian and Dr. Waseem Ahmed. Dr. Venkatesh Shankara Pandian is a professor and HOD of Department of Family Medicine, CMC Vellore. He graduated MBBS from Tirunelveli Medical College and completed DNB Family Medicine from Christian Fellowship Hospital, Odanjitharam. And Dr. Waseem Ahmed has done his MBBS at Government Tanjavur Medical College, did DNB Family Medicine at VPS Hospital, Lakeshore, did fellowship in diabetes, geriatrics, and diabetic food care management. He was awarded the Best Research Project Award in Fellowship in Diabetes Management. Currently, he is the lead physician at Loop Health Pune and visiting consultant at Apollo Clinics.
The speaker for this session is Dr. Ramakrishna Prasad. He is board certified in family medicine with expertise in infectious disease and public health. Currently, he practices as a senior consultant of infectious diseases and family medicine at Trustwell Hospital, Bangalore, and at PCMH Restore Health, a patient-centered medical home and incubation center for innovation, people building, and collaborative problem solving. He also serves as the president of AFPI Karnataka and the AFPI chair for primary care research and policy. He is associated with several networks focused on leadership in public health. Over to the chairpersons.
I invite Dr. Ramakrishna Prasad to start his talk on how to write a research article.
Yeah. Thanks. So, thank you for this, for inviting me for this session. So I think it's been a long day. If we can all stand up for a minute. Can we all stand up for a minute? Stretch, please. Stretch. Yes. Thank you. Lift your arms, shake them. Thank you. Okay, great. Thank you. So, how many of you here, many times people think a topic like this is only for PG students. Not so. But how many of you are PG students in family medicine or any other specialty? Please raise your hands. Oh, fantastic. That's like 80%, 90% of the room. How many of you are faculty of family medicine? Wonderful. And anyone else here who doesn't fit, any general practitioners from the community? Great. A few of you. Thank you. So, what I want to talk to you about is I meet a lot of people. They say, I want to write a paper. And when I speak to them, they have fantastic ideas. They have a desire to grow. They have a desire to establish themselves, make a name for themselves. But for every 10 people, every 10 individuals I meet who says, I want to write a paper, I meet 2 who successfully is able to publish a paper. So this talk, over the next half an hour or so, I will talk to you and walk you through the heart set, the mindset, and the skill set required to convert ideas for research into publications. And I'm really excited also to have our distinguished chairs, Professor Venkatesh Pandian and Waseem. In fact, in my talk, you will see I've taken an example each of their papers to illustrate a few points. Oh, sorry. So what we'll do over the next few minutes is we'll reflect, we'll discuss why do we write? Why write at all? And I want you to share your responses to that. Recognize that writing successfully involves your heart, your mind, and your hands. Understand the anatomy and flow of a paper. This is critical. Understand that a paper has a certain structure to it. It has a certain flow to it. We'll take a few examples of family physicians who've published. And we'll see what kind of a paper that is, which gives you an entire range of possible paper formats for you to publish in. All of us are not excited by the same format, because what we want to communicate, to whom we want to communicate, and the style in which we want to communicate differs. So we'll take a look at that. And lastly, I want you to leave this session having gained some insights into your own motivations as to why do you want to write, and perhaps a few tips on writing. Why write? Can I hear from a few of you? Why write a research paper? Anyone? For promotions. Okay, fantastic. Are you a faculty member? Which department do you work in? Physiology. And you work in which medical college? Wonderful. Thank you, ma'am. So that's a very honest and actually a very very practical answer to get promoted. Any other reasons to write a research paper? Lengthens your CV. And ma'am, if you could introduce yourself and tell us why having a longer CV would be helpful to you. Please give her a mic, please. And yeah, keep the lights on. Yeah, thanks.
I am the HOD of Family Medicine at KG Institute of Postgraduate Sciences.
Wonderful.
And also an examiner to the DNB.
Okay.
It's almost 18 years of my practice as a faculty and 10 years as the professor.
Okay.
And I thought if I start writing papers and I do my CV, my PGs may be...
Sure.
Yeah.
So
they will be excited,
they
will
would be,
join me,
it would
they will
inspire
help me,
them. Right.
They will try to share my paper till they start writing their own and so many things.
No, so thank you so much for such a truthful and actually a very valuable answer. So yes, if you publish papers, I think 2-3 things happen. Number one, the depth of your own knowledge, learning, practice definitely improves. Second, you grow in eminence. More people know you. Third, you grow in influence. More people read, they may be inspired by your work, you become a greater, stronger role model. So thank you very much. One more response from one of the students out there. Yes, sir, Dr. Shaw Wallace.
What we are enjoying is because of multiple papers which have come out.
Okay.
The knowledge and what we are enjoying, like this is the result of what many people have done. So small studies are put together and we have got a amalgam of this thing.
Wonderful. So what Dr. Shaw Wallace, who's both an orthopedic surgeon and a family medicine physician, what he's saying is we are standing and we're standing here because others have shared what they have learned and the research that they have done, and we also have a responsibility to document that which we are seeing. Like if you heard the speaker on thyroid problems, there were so many interesting tidbits on how to apply knowledge unique to the context of Madurai, practicing in Madurai. But if he does not share that with others and does not share it in say the written form, 5 years from now, if say I see a patient and I do not know what to do, I may not be able to find or access that knowledge. So contributing to that body of knowledge in a field is absolutely critical, and it's a professional responsibility. So thank you. Anything we speak about, just knowing that we must write a paper is not enough. Even knowing how to write a paper is inadequate. If I now, in your DNB programs, or a few of you in your MD programs, or even in your MEd program, perhaps writing a thesis is a requirement. You will pass your DNB examination and you will show how to write a paper. But even that, in my opinion, is not enough unless you imbibe the value that as a professional, as a complete professional, writing and contributing and advancing the field itself is part of your responsibility. So after this talk, I want you to leave with the resolve that you will grow into clinicians who are also scholars and researchers and teachers, of course. I already said this, writing involves your heart, it involves your head, it involves your hands or skill sets. Why is research and writing by family physicians so important? Can you share a few reasons why we must do our own research, why we must publish, and why does this matter? Yes, primary reason. Because so it applies to us. What a family physician sees is more likely to be of benefit to other family physicians because they are likely to see a similar spectrum of illness in the community. Why else does it matter? More community-based studies, absolutely, absolutely. What else? Very important point. So that look at prestige. Look at prestige in any field or specialty. The most prestigious fields or specialties are those which are either associated with a high level of intellectual kind of research and intellectuality, or they're associated with cutting edge technology. Family medicine actually does not lack either. In fact, Dr. Vasundhara was sitting there. She sent me an article yesterday which said on an average day, a family medicine doctor in their daily practice comes across at least 15 research questions, which may be something very simple. Like I see this patient and I say, how common is this problem? Most of these questions are unanswered. If they went and looked at the literature, they would not actually find the evidence they're looking for in their practice context. So absolutely. I'll take you through a few reasons why we must do our own research and why we must publish. This is how a full-fledged family medicine doctor is seen and should really see themselves. A family physician, family medicine doctor is a care provider. We have to be exceptional clinicians.
And as the PTs over here, don't leave the session. Because you have, first years have to put a thesis protocol by this method. Also, will you join? And others also, this is very important. Because many times when we approach the government, the problem what we face is why you don't get a specialist care, right? That's your query. And when we approach the government, they say that there is no primary care research actually happening and show the evidence. So please be here. Don't leave the hall before it ends. Okay?
Thank you so much, Dr. Lizzie. So full-fledged family medicine physician is a care provider. We have to be exceptional clinicians. We are the ones who see undifferentiated presentations in the community, and we have to use the best of our clinical skills. This morning I attended the workshop by Dr. Frick and Dr. Jekin, and that was one of the main things I took home from that. Second, we serve as a consultant. We serve as a consultant not just to, we serve actually as a consultant to multiple other players in the healthcare system. These could be nurses, these could be clinical pharmacists, they could be ASHA workers, like Dr. Ramaswamy's practice, the community health worker cadre that he's developed, or to other specialists. You'll realize that once you build your professional network, a lot of different doctors will call you and ask you to serve as a consultant to them. Capacity builder, unless we build capacity within our community by transferring our skills to others, we are not going to be able to solve complex community problems. As clinical trainers, you know, Dr. John Jacob is here. Some of his students now are working across the country and doing a phenomenal job as family physicians. And many of you as teachers are seeing that. We have to train our people in the next generation. Clinical governance leader, what this means is quality assurance in your clinic is your responsibility. Leadership for that is your responsibility. and being a champion for community-oriented primary care. That's your responsibility. Now, all these things, each of these domains and dimensions lends itself to various forms of very, very interesting and important inquiry, which is research. Then, family physicians don't just talk about the disease in front of them. They have this richness, they have this amazing richness. They know about the individual, they have a long-term relationship with that individual, and there are so many things which are known and understood because of that relationship with the individual. They understand their community. They understand the determinants in that community. They also understand the larger society, its economics, its ecology, its dynamics, etc. And these are not captured by any other specialty in medicine or even in the larger public health, field of public health, which focuses on systems. So this is absolutely unique context and scope of practice. We in family medicine focus a lot on our communication. What this does is the richness of the stories, richness of the insight that you gain is absolutely remarkable. And this has to be captured. We take on the primary responsibility of coordinating care for our patients and their families in an extremely fragmented and often hostile system, healthcare system. That itself is a story. What are the models of optimal coordination for patients across the social spectrum? How do you do that? How do you facilitate continuity? How do you prevent? I missed Dr. Rajkumar's talk this morning, which I was really hoping to attend, but I heard about it. He spoke about how do you prevent suicide in the rural community he works. And these are actually models which involve innovation. Innovation and research are deeply interconnected, and we must document them. Dr. Raman Kumar mentioned this in his comments today. For every 1,000 individuals in any community, what you find is in any given month, 800 people report some symptom. Not all of them rush to a hospital. Of them, 327 consider seeking medical care. They may not seek medical care. The first place they go to is they either go and visit a complementary alternative medicine practitioner. This in different parts of the world, it is different. It could be an informal provider in many parts of India, or they go to a family physician who is located in the community and has a clinic. Of them, 8 require hospitalization, and only 1 out of 1,000 comes to a tertiary care teaching hospital or academic center like this one. Where does 99% of our research happen? In large academic centers like All India Institute of Medical Sciences or CMC Vellore or PGI Chandigarh. But where is the majority of care and dynamics and family medicine and what we struggle with, what patients and community struggles with? Where is that happening? That's not happening there. So it's an imperative for us to understand our own scope of practice and document that. Also important is you go practice from one locality. I'll give you an example myself. So I used to go as a doctor to 2 hospitals located on 2 ends of a metro line in Bangalore. In one hospital, women coming with urinary tract infections, you would find that the E. coli was largely sensitive to nitrofurantoin. At the other hospital, on the same metro line, women coming with urinary tract infections, the E. coli, was almost universally resistant to nitrofurantoin, but it was sensitive, fortunately, to Bactrim. So what matters is there is hyper-local context. There are very few generalizable truths. You have to know what works in your community, what doesn't work in your community, what are the unique patterns that you see. And so your work and your observations are relevant and important all the time. That's very important. Lastly, look at the range of services that a family medicine practitioner or a clinic provides. The range is actually dizzying. It's huge. Your practice is an incredibly rich laboratory, which is teaching you things every day. You're observing things, you're experimenting. A lot of our care is experimentation. Let's try this and see. Come back in 2 weeks. If you're better, maybe this worked. If it didn't work, we have to think again. These are experiments. This is actually experimentation. So what are you engaging in? You are engaging in experimentation. Family physicians also ask unique questions that translate and transform daily practice. Nobody else can do this for you, right? Quality improvement. If, for example, in my practice, if say I have 100 diabetics and I have no idea what is the HbA1c in my patients, if I do not know, who comes to my practice? Just asking who comes to my practice, where do they come from, what is the average HbA1c, how many people have other comorbidities, how well is their sugar controlled or blood pressure controlled, itself is a research question. And then if you intervene, you in the process of gathering this data or understanding who comes to you, you may realize, oh, if I scheduled my follow-up in this manner, it may facilitate continuity. And then in 6 months you check and say, oh, the average HbA1c has dropped, or in my previous analysis I found that there used to be people from this pocket who would tend to have poorer glucose control, but then because I started going to that area, I'm finding that things have improved. This is quality improvement, quality improvement, and which is a form of practice-based research. This is how a lot of our research looks. You identify a gap in your practice or your community. You search for answers. Many times you can't find it. Then you say, how would I write this as a question? And then you don't have to design very complicated studies, but sometimes just in the process, that curiosity, what's actually happening here, gives you insights. You analyze or synthesize, and then you implement, and you change things. There is this concept of a sweet spot, which does help. So family medicine research is, I think, particularly impactful if it takes its questions. If you take your natural curiosity and ask, is this of relevance to primary care or your community? Most of the questions you ask will be. You ask, is this of interest to patients? Might I be able to get funding? That is a certain different level of thinking. It requires some institutional linkages. Is this perhaps novel, and can it be written as a better defined question? I'll take you through a few precepts now. How to write successfully. Precept number 1, you have to realize, even though a research paper may sound very dry, it is a form of storytelling. Most writing is a form of storytelling. It has a certain form, it has a certain flow. Most papers, even in medical journals, have this kind of a dramatic structure. There's a start, there is curiosity, there are characters, there is a theme, there is context. Something happens. Usually there is an inciting case, or there is a question, and then you do something about it. You find something, you find an answer, you put things in perspective, and then you narrate what you found. If you understand this, you've actually learnt a lot. Any paper like in anatomy, we learn about the head and the different parts of the body. If you see a paper has these parts. Take any paper from the Journal of Family Medicine and Primary Care, JFMPC, or any other journal. You will see that there is a title, there is a list of who were the authors, author affiliations, then you will find an abstract. Abstract has a few parts, and then you'll have an introduction. The last paragraph of the introduction section usually has the specific aims of your study. It says, in this paper, we, number one, determine this, evaluate this, we describe this, you know. Then it's got typically literature review precedes that. You have a methodology, you have a result section. Result section is where you just report what you found. You don't comment on that. You don't say, this is what I think it is, because the section where you do that is called the discussion. And then you say, what are the take-home points? In conclusion, we want to highlight 1, 2, 3. And then you have acknowledgements and references. This is the anatomy of any paper. If you master this anatomy, you will operate successfully. There's also a directionality to the flow of information. The flow of information usually goes like this. It starts with things everybody knows. Like diabetes is a major problem in India, or major global problem. Then it comes down to things which fewer people know. However, in Madurai, diabetes has become a particularly important problem in the last 2 decades. So this starts giving you context. Then you say, one of the major transitions, I'm just making up this story, okay? One of the major transitions is there has been a significant rise in diabetes even among those whose body mass index is normal. In that context, our study wanted to determine what perhaps drives this, you know? So it's got a certain flow to it. What we'll do next is I'll take you through a few examples of the diversity of styles or types of papers that family physicians write. And I chose this list very deliberately. I chose this list based on several criteria, including the fact that several of them are here in the room. So you can go and talk to them after this session and ask them, sir, madam, when you wrote this paper, how did you think through it? I'll go and read this paper tonight, and then so many thoughts will come. Maybe I can ask you, can I do this in the future? Can I take your guidance? So recently, so actually exactly 5 days back, I made a home visit. So I make home visits. And this was an 80-year-old woman who was a retired chemistry professor. And she had bilateral lymphedema and bilateral lower extremity cellulitis. She had received antibiotics. Many people in her family are doctors. Many of them are very, prominent physicians. So she had received antibiotics at home for 3 months. And then, but what really was helping was magnesium sulfate dressing, right? And as I went with my nurse and we did the magnesium sulfate dressing, there was a wound, we put paraffin gauze, and then we did this. I realized I've never actually had any formal training on when to use magnesium sulfate, how magnesium sulfate came into clinical practice, where did it come from, when did it come from. And I did a Google search and I found this paper in the Indian Medical Gazette, published in the 1940s by this Englishman, who wrote in the style many papers were written back in the day. People who wrote, etc., would be called men of letters, right? I'm just going to give you this example. So he writes, in the chronic cases, I felt that no good was being done. Judging by the slow progress of cases and that in all probability much harm was caused by the powerful action of chlorine upon the growth of young cells, making a feeble effort at repair. I have always felt that frequent dressings, wet or dry, were more of a hindrance to nature than otherwise in both chronic, acute and chronic cases. It's rare to find this kind of language and flow in the modern research article. But I will say this remains the most engaging form of writing and reading. What's happened is many who are masters at this form of communication, they have moved to writing blogs. So Dr. B.C. Rao, who many of you may know, and who's a mentor to us at AFPI Karnataka, and he and I used to edit AFPI Karnataka's newsletter for 4 years, every 3 months. And I had a very enjoyable time, learned a lot from his style. So what he does is he writes a blog. He writes about cases, he writes about people, he writes about experiences as a doctor. And he interviews all those dimensions of being a family doctor. I know this family for the last 40 years, his grandfather used to be this, and then he would say, in that community, this is what has happened. But when he came, this is what he had clinically. This is what I intervened. This is what I learned when I looked at the literature. And this is the outcome that came. I want you to leave with this message. See, you don't only have to publish in journals which have a restrictive format. For example, we call this the IMRAD format: introduction, methods, results, and discussion. You can choose this form of which is closer to storytelling, but which actually combines the qualitative depth of a story which you gain from communicating with people and your clinical acumen and expertise. The third, Dr. Waseem is here. Dr. Waseem, as a family medicine doctor, I'm sharing this conversation. So he would see a number of patients who would ask, how do I control my diabetes during the month of Ramzan? And what Dr. Waseem did was, the COVID was raging, so there had been a disruption in how people could do this. And so Dr. Waseem actually thought about this. He gathered a team, which included an endocrinologist, if I'm not mistaken. And then he said, how will I advise patients so that they can manage their diabetes well during Ramzan in the context of COVID? He looked at the literature, he looked at all the papers that had been published, and he published this excellent article. I would encourage you to go speak with Dr. Waseem after this session and ask him how he went about this and how he can guide you with your own work. This is from Dr. Venkatesh. So, sorry, there's a spelling mistake. But Dr. Venkatesh, he is a professor of family medicine, and one of the big questions over the last decade has been, what should be the curriculum? What should family medicine doctors, what are the skills and competencies that family medicine doctors must possess? And so back in 2000, so this paper, which is written with other colleagues from the CMC Vellore Department of Family Medicine, speaks about designing a curriculum for postgraduate training in family medicine in India. How this is valuable is, now for example, one of the hospitals you go to, or one of the hospitals the faculty go to, says we want to start a diploma in family medicine or a DNB in family medicine. And they say, you're the only person who knows what is family medicine. You will start asking, what should my residents know? What should they know? And immediately you'll say, where can I find out what should they know? Of course, one part is whatever you experienced. But say a colleague who is the medical director, maybe a surgeon like we met today, says, tell me why it is important for family physicians to learn this, because you want to set up a rotation. Then you'll have to defend yourself. So in the process, you say, I went to the literature, this is what the experts in family medicine say, and this may actually influence what the National Board of Examiners incorporates as the DNB curriculum. So it could shape what you yourself are expected to learn and what you will teach others. So please talk to Dr. Venkateshan about educational research in family medicine. Many of your own, and education simply doesn't mean teaching in a medical college or a residency program. How do you educate your nurses? How do you educate your community health workers? He's a proponent of something called the field note. Ask him, can I use field notes to train my team? This was an article that Dr. Rao and I wrote, which was probably one of my favorite articles. We took 5 stories from 50 years of his practice, and we wrote a commentary. We took each case and said, what does this mean? What does this teach us? And it was it turned out to be a very enjoyable article. Recently, I got an email from someone in Ukraine. They had read this article, and they said, in Ukraine, we have family medicine as an emerging field. We read your article. We saw how you have taken stories and cases and reflected on them. And then we saw what you identify as the principles of family medicine. In Ukraine, we agree, we have the same, but we differ in this one way. Can we discuss more about this? So you know, a paper that you may write, which you may never think that someone in Ukraine will read, may actually read, they may engage with you, which is very enriching. This is a paper I wrote a few years back when I was in the US. But here, if you see, this was a national survey of program directors. I show this because in each of these papers, you will see that the author has a certain target audience in mind. The author writes for a certain reason, and the author chooses a certain format for that reason. So this actually resulted in, I had initiated a family medicine HIV training track within a residency program, and this resulted in expansion of that to multiple sites. This was a great paper recently. Dr. Gargi Goyal, Pavitra Mohan, and Sanjana Mohan, they are pediatricians, but they are involved in this organization called Basic Healthcare Services in rural Rajasthan. And Dr. Gargi, though she's very experienced as a pediatrician, recently completed her PGDFM. And she learned about the 3-stage assessment from the CMC Vellore PGDFM program. And in their rural community, they had a few patients. They had this one patient in particular who had epilepsy, which was very hard to control. So they took this, and this is published in a journal which has a section called Child Health in the Hinterlands. So you can imagine that it has a certain audience in mind. And they wrote about several strategies that they used, which broadly fit into what is called community-oriented primary care, and how that was effective in controlling seizures in this child, in this adolescent. And they reflect on the 3-stage assessment and how that kind of an approach helped. Dr. Raman Kumar. Here's a flavor of some of his articles. If you see, the roles and training of primary care doctors, China, India, Brazil, South Africa. Or lack of social or political demand for good health care in India, impact on unfolding universal health coverage. Or there are articles by him where he's looked at the manifestos of all the political parties in India, to ask how many times is health mentioned, what about health is mentioned, is there a regional variation, and he finds that other than Kerala and to some extent Tamil Nadu, none of the major political parties mention health in their manifesto. Now because his view is about, he wants to engage with policymakers and engage in the process of advocacy, you can see clearly who he wants to communicate with through these papers. This was this is the last example I'm showing you. This was a delightful example. So in this emergency room in Saudi Arabia, you know, there was a child into whose ear an insect went in. Now, what do? You may not have the instruments or the experience of going into the external auditory canal of a screaming child and get that insect out. Maybe you can pour some spirit and the insect may die, but then you still have to bring it out and the child is in pain. What they did here was they closed the lights and they used a torch and they shone torchlight and the insect was alive and it came out. Right? And thanks to JFMPC, our journal, there was a platform to publish this as a paper. This is incredibly useful. If I'm in a place and there is an insect in someone's ear, I know what to do, right? This is not a randomized controlled trial. It didn't require millions of dollars of funding. But this is the type of scholarship which family medicine and the community can generate. And I love this example. So precept number 4, which is a summary of what I showed you, is each of you has a certain motivation. You will write for a certain reason. Maybe it's promotion, maybe it is eminence, maybe it is DNB theses, maybe it is your own growth, deepening of scholarship. But you will have a target audience. Recognize that you have a target audience and a type of message to give. Each type of message has a corresponding format or form. And if you look through the author submission instructions of JFMPC, you will realize all the different formats that exist. Last precept in the remaining 3-4 minutes. Very, very important. So everyone wants to write. Few people manage to write, but very few people manage to successfully publish their work. Okay? Those who do, they manage their energy. They manage their energy. Writing requires time. It also can be tiring, but if you manage your energy, you can accomplish this. The most important concept I experience for myself even as an author is I have to be conscious of my own patterns of energy. So the energy is influenced by many things. Reader expectations is one, but that's an unknown concept. I really do not know what readers expect from me. But I can gather what I expect from myself. If I do not have a strong why, like recently I've been, there are 3-4 papers which are incubating on my desk, and some of them have not made progress. And when I introspect and say, why has this paper not advanced while some other paper has advanced? It's usually because I'm not very clear why I'm doing this, right? So getting an understanding of one's own personal why is very critical. I have not found it very useful when people talk in terms of should. We must, we should. You know, there are so many things which should be done in life, but you know, ultimately we all do things which give us joy, which are meaningful to us. The second is length. If I do not know how long something has to be, am I writing a book? Am I writing a chapter? Am I writing a 5,000 word, what am I, synopsis? Am I writing a 1,000 word brief article? What am I writing? And lastly, how familiar am I with what I'm trying to write about? This is another important concept. It's hard to be successful if you use a exploratory left to right approach. If I say, today I will think of a question. Over the next 2 years, I'll find data. Then I will think how to summarize this. Then I will talk to my professor or my teachers and say, how do I edit this? And then I'll look for a journal which may publish this. That's a 10-year journey and your paper will not get published, I can tell you that. You need a right to left framework. I mean, I'm not asking you to force yourself to become interested in something. But once you say, hey, I'm seeing a lot of diabetics in my practice and would like to know, or I visit Dr. Mohan Kubendra's clinic, he is an expert in diabetes, and I see that there are in certain patients, he starts an SGLT2 inhibitor at the time of initiation of therapy. And I'm curious, in whom does he start? And I go ask him, I say, sir, can you give me your, can you tell me who you start this? He'll give you some logic or rationale. And then if he says, come, look at the data in my clinic over the last 6 months or 1 year, examine who I started and what were the characteristics or what predicted my use. And you may find that those people were either, their weight was higher, their socioeconomic status was something. This is great research actually. But if you have a deadline, you say 1 year from now or 6 months from now or 3 months from now, I will publish this in JFMPC as a brief report with Dr. Mohan Kubendra as a co-author, perhaps the senior author, where all I am doing is I'm doing a chart audit of patients in his clinic in whom an SGLT2 inhibitor, dapagliflozin or whatever, empagliflozin or whatever he likes, was initiated, and asking the question and comparing it with those in whom that was not chosen. I'm going to publish this. And if I need some guidance in, making this happen, I speak to Dr. R.K. Prasad. So, that's kind of how this happens. So you use a right to left management process. I will leave you with 3 writing tips now. The first writing tip is, please write first. Do not edit at the same time. Do not mix up your writing and your editing. You will accomplish very little writing. None of us are perfect. None of us write delightfully when we first start any draft. That's not how it happens. Write first. It may sound bad, it may read bad, there may be grammatical errors. Do not stop yourself. Write. And then you edit. Because the brain uses different processes. See, editing is an analytical function. And editing forces you to look at the same piece of writing from someone else's perspective. How will the editor look at this? How will a reader look at this? But writing is an internal creative process. So don't mix these two up. Just do 1 more minute. Your sentence structure has a significant effect on the reader's energy. An ideal sentence, which very few of us write, is able to sustain someone's energy for longer. But most sentences, the way we write, so I'll just leave you with this thought that actually your sentence structure has an impact. And the last point I'll make is, make your sentences short. That doesn't mean you have to create with short sentences. That may not be your natural flow, or that may not be the way you think or talk or write. But when you edit it, make your sentences short and keep the distance between the noun and the verb small, and match your noun to your verbs. So I'll leave you with this. Why must we do research and why must we write? I'll leave you with this quote. The role of a doctor is not merely that of a diagnoser of diseases, prescriber of pills and potions, an exciser of lumps. A physician should also be a researcher, a case finder, a counselor, a role model, and most importantly, an agent of social change. I think most of you here will become this ideal physician. There are many here who are this ideal physician, and this is a great opportunity. So thank you very much.
That wonderful talk. I think everybody in this room, we are convinced that we should do research and write publications, at least about the patients we manage. We can entertain maybe 2 questions because we are already delayed. And
Sir.
Only one anecdote I just wanted to tell.
Please, sir.
Regarding this, you were writing the paper and the people in Ukraine read it. Similar to that, the previous speaker, endocrinologist Dr. Annamalai, he used to tell interesting cases like what he has mentioned. Once he told, after reading his paper of a patient having severe pain all over the body, nobody diagnosed what it was. It's a case of pain all over the body. Like they were all thought it is rheumatoid arthritis, things like that. Ultimately, it was a bone tumor in a small place, like a phalanx. which is producing the fibrous growth factor, FGF factor. So that was, of course, extensive trials and imaging sciences, he could diagnose it. And he made that paper. And one patient who was bedridden and was wheelchair ridden, he is suffering from severe pain. He read this article and contacted him. And Annamalai made a correct diagnosis and he was made pain-free. And he says, I never knew what is a painless life. He was so blissful. So that is all due to this article. So this only I wanted to mention that.
Thank you so much, sir.
Any other questions from the audience?
Okay, very good question. Yeah. So in the Indian landscape, in my experience, you're fortunate if your hospital has an ethics committee, but many of us in family medicine are not part of institutions like that. So actually I had a very nice conversation with Dr. Waseem, who is an assistant professor of community medicine at Madurai Medical College today. And for local physicians, one of the things we were discussing was we could perhaps collaborate together, wherein someone, for example, who falls outside of an institution can utilize a collaborative framework and use the ethics committee of that institution. We have done that in Bangalore with several hospitals. Usually hospitals, what happens is their ethics committees are also quite reluctant to give clearance for studies which are done outside their control. There are a few ethics committees. If any of you is having trouble with an ethics committee, please let me know. I can connect you to a few community-based ethics committees. One which has been very helpful to me has been the ethics committee at Swami Vivekananda Youth Movement, SVYM, in Karnataka. They charge about 5,000 rupees, but they have been permissive of these studies. The other is basic healthcare services in Rajasthan. So I can assist you with that, but that's a great question. Thank you. Approach publications. JFMPC, the Journal of Family Medicine and Primary Care. Dr. Raman Kumar is the editor-in-chief. Dr. Venkatesh and Pandian and myself, we are associate editors along with a few others. Please approach us, because all your research, which will fall into the highest priority category of JFMPC, number one, which will give the opportunity for a lot of this to be waived, the publication fee to be waived. And if you need any guidance in terms of, editing or positioning or whatever, one of the editors can help you. But please utilize JFMPC for your research. And that's a great, I publish most of my work in JFMPC now. Thanks.
I'll just comment one thing. I just want to thank Dr. RK for that talk. I also want to acknowledge it as I come from Matanjitram, Christian Fellowship Hospital, and we have a MOU with Madurai Meenakshi Hospital, Meenakshi Hospital, and our residents come here for their ethical committee clearance. So that some institutions allow that, and we are very grateful for that.
That's wonderful. Thank you.
With that,
Thank
we
you,
come
sir.
to the end of this session.
Thank you,
Waseem,
sir.
you want to say?
Now I would like to request.
Just one thing I wanted to mention. See, don't be afraid of publishing. No, what you write for the thesis is only what you're going to publish. It's only we have to reframe or redesign few things according to the requirement of few journals. That's all. You have already done everything which needs to be published. If it's a quality information, definitely the journals are going to accept it. Search for good quality journals and see the format of it and start publishing. That is one thing. Suppose your papers are not ready, you are coming across interesting cases like what you have done in the poster presentations today, etc. Try to publish that as case reports. Very small data, not too big lengthy pages all. Just 2 sides of case report, more than sufficient. 500 words, you can complete the case report totally. With images and illustrations, you can publish it. So start with small things and then you can step up anytime later on.
Thank you, Waseem.
Thank you, sir. Now I would like to request Dr. Mohan Gubendran to honor the speaker and the chairpersons. I request Dr. Mohan Gubendran sir to also honor Dr. Safir sir. Thank you, sir.